Welcome back. Now, President Cyril Ramaphosa has urged people to continue following precautionary measures as the country moves to level 2. The National Command Council is now expected to brief us at 2 p.m. this very afternoon on the eased regulations. But to discuss this even further, I'm now joined by Professor Salim Abdoool Karim, the chairperson of the COVID-19 Ministerial Advisory Committee. Professor Karim, thank you so much for your time. I mean, what advice then the NCCC as well as Cabinet, not only to move to level 2 of the lockdown, but also to lift that ban on alcohol and tobacco? This after continuous concern has been expressed by government to say we're not ready yet to, lift that ban. There's still some medical, assessments that we need to conduct till we are definitely sure that lives are not in jeopardy here.
Yes, good morning to everyone. When we look at the way in which the epidemic has been progressing over the last 2 to 3 weeks, we're seeing quite clear trends that show a decline. And ideally, we'd like to see about 14 days of decline, and that's certainly been the case for the entire country and most of the provinces. And so the decline is quite clear. With the issue of, so what to do next, and how do we prepare for this next stage of our response, it really needs to focus now on us ensuring we're not complacent, that we continue, the important measures that we've become quite good at mostly, washing our hands, ensuring we social distance and wearing our masks. But we also need to be aware that the threat is ever present, that this virus is not going away. We still got about 3,000 odd cases. We need to ensure that it continues a decline. We expect, because of easing of our restrictions, that there may be a slight increase in cases, and that would become evident in about 10 days' time. So around the 28th of August, we'll watch very carefully what the numbers are doing. And if we don't see that increase, or if we see a small increase, we can be confident that the easing has not had a major impact.
Now, Prof, speaking of the numbers, we've been getting regular numbers from the Health Department in terms of confirmed cases, recovery rates, as well as that death rate. And I'm seeing quite a concerning article here, and this is based on a research conducted by the Burden of Disease Research Unit. Now, they claim that the numbers that we've been seeing in terms of the death rate, we're now sitting at approximately 11,000 plus, could be misleading. They say that we might be having that number standing at over 20,000. This the number of people that really have, died from either COVID-19 or COVID-19 related, incidents or other diseases and illnesses. Can you clarify this for us, please?
Yes, sure. So in our setting and in many countries, we have a way of estimating how many deaths we are expecting. And this is, deaths from all causes, whether it's, people dying from just, getting a stroke or whatever. So when we look at whether the number of deaths is at the level that we are expecting, then we know that it's within range. When we see the number of deaths actually occurring is higher than what we expect, then that is referred to as excess deaths, or deaths that we did not expect, we would not have normally expected if the conditions didn't apply. So when you look at that, and if you take for the period that we've had the epidemic from the 5th of March, then more or less we're seeing that there's somewhere in the order of around 25,000 up to 30,000 deaths that occurred that were not expected. So in other words, that this is more than we should normally have seen. Now, it depends on how you categorize it. Let's just, for simplicity, just take all deaths. So the excess number is in the region of around 20-odd thousand. If you go with that, then we can work on the basis that the reported COVID deaths are being underreported, and they're probably being underreported. About half the number of deaths are being reported. That's not unusual. You would expect that. Most countries have that. It occurs mostly during the surge. Because hospitals get so busy, they don't report straight away, and there's a bit of a lag, and the death reporting catches up. Where it doesn't catch up, then we would need to go back and adjust for it. And it's probably what's occurring is that deaths are occurring before they get to a hospital, or deaths are occurring in a hospital that are just not being reported, or there may be deaths that are not COVID, but they just might be a consequence of the lockdown or the restrictions or patients not getting to care rapidly enough. So it's a combination of all of those. Regardless, we can work on the basis that our death reporting is probably underreported. If we take all excess deaths who are actually COVID, probably we're only reporting about 45 to 50% of all deaths due to COVID. That means our death rate is probably double what it is right now. Even if it's double, we still have a very low death rate in relation to other countries. We would rank, somewhere in around the 60th on the list of countries and their death rates.
Yeah, and just briefly, Prof, you mentioned there that surge and continuously warn South Africans that do not relax. Level 2 lockdown does not mean that we're out of the clear yet. We still need to adhere to, complying with regards to precautions so that we remain safe. Now, my question to you is, even with that surge expected, that second surge expected, how are you then preparing for it, particularly when I look at it in some of the provinces that have been showing high numbers? That is of course, Gauteng, KwaZulu-Natal, the Western Cape, just to name some of them. How are you preparing those provinces, especially because, there have been comments coming from different, provincial governments that perhaps when one particular province goes to a level 2, let the other one, which is showing high numbers, remain at level 3 so that they can try and manage that peak.
Yeah, so as we look at the situation, we want to ensure that, the numbers of cases are just continuing to decline steadily, because, that's the thing that really worries me most. I get sleepless nights worrying about, when I've seen what has happened in some other countries, that as they were on the decline, they eased their restrictions and people became complacent, and they had a second surge, and it's worse than the first one. And I was worried that that might occur here. I've been very pleased that the trends that we've seen, that hasn't occurred, and it doesn't look like it's going to occur at this point. But we have to be vigilant. As we saw country after country where the virus was actually contained. New Zealand even announced on Monday last week that they had eliminated the infection because they had 100 days of no transmissions that occurred locally. And then 2 days later, they go into lockdown because they have 17 cases, a whole cluster emerging. So you can't be complacent. There's no room for complacency. Because this threat is ever present, and because we don't have a cure, we don't have a vaccine, we are always vulnerable. So that means that we have to prepare for that. First thing about preparing is to know what we need to prepare for. So we have to know what we are expecting. We can look at other countries and we have a pretty good idea of the nature of how this occurs. And mostly it occurs in what we call small outbreaks. When that happens, it seeds and then it spreads rapidly. So we've got to maintain our vigilance. So part of that is to ensure that we continue our testing, we're monitoring the spread of the virus, and that we have teams that go in, can deal with outbreaks as and when they occur.
Right.
If we deal with the little fires, we won't see the inferno.
We'll leave it at that. Thank you so much, Professor Salim Abdoool Karim, just in time to pick up that call. Thank you so much for joining us right in the South African morning.